Hello there, this is Dr. Indhu. Today I'm going to talk about the various guidelines which are available for physicians in management of diabetes. The most famous guideline which is followed by many physicians is the ADA guidelines, that is the American Diabetes Association guidelines. But I feel this is tailor-made for Americans. So should we Indian doctors follow it? My position on this is big no. Second in line comes the EASD guidelines, which is a European guideline followed by European countries. So better not to follow these guidelines in India. The third one is NICE guidelines, NICE. They are really nice, followed in UK by the NHS, that is the National Health Service. National Health Service is fully government funded. So these guidelines are very practical. It is very equitable and it is not market driven. So among all these guidelines, I follow NICE guidelines even though I practice in India. And of course, in India, we have our own RSSDI guidelines. But among the international guidelines, I find NICE guidelines very practical and not market driven. It caters to all classes of people. There are very clear guidelines about when to escalate the dose. When do patients require fancy treatments like GLP-1 receptor analogs and insulin pumps? It is not these unique treatments are not dished out for each and every patient. Whereas in countries, even in our own country, it depends on the affordability of the patient. The patient might really require GLP-1 or an insulin pump, but if they could not afford, we try to give them the lower rung of drugs. Whereas if the patient is affording, even if he doesn't really need GLP-1 or a pump, we put them on pump. So this is the real picture which is happening in most of the countries in the world. So NICE guidelines is the nicest guidelines, and I request all doctors to at least go through these guidelines and put it into practice in their day-to-day management of their patients. Thank you.